Institutionalizing Economic Inclusion for the Rural Poor by the Gates Foundation. It is my pleasure to welcome the panel. Madam Lynett, who joins us from Kenya, is the Deputy Director of the State Department for Social Protection. We met her yesterday in the same auditorium. Welcome, Madam Lynett. Sam Owilly, the CEO of BOMA, was also here yesterday. As we know, he's a respected senior expert on topics such as poverty alleviation, financial inclusion, livelihoods, and climate change. Shobhini Mukerji joins us. She's the Executive Director at JPAL South Asia Regional Center. Shweta Banerjee, the country lead for BRAC, is also here. The moderator for the session is Anjani Kumar Singh, Senior Program Officer at Gates Foundation. We're also joined by John Paul, who is the Senior Director at the Nudge Institute and heads the rural development efforts across the country with the Economic Inclusion Program. Thank you very much. Over to you, Anjani.
Thank you, Napina, and thank you, the Nudge team for organizing this wonderful event. I see a lot of, young people coming and, joining this event. I would say that one can't have the better moment and a better platform and a better panel to discuss, this topic. We have, as Napina introduced, we have, the researcher, we have a practitioner, we have a policy makers, everyone, as part of this panel to discuss this topic. I also say that, why this is a better moment, and we can't have a better than this, because especially if I talk about India, I think people have, both the policymakers and the practitioners have got a confidence that India as a country can deal with extreme poverty and we can get rid of it. I think the Prime Minister already in the last Niti Aayog Governing Council meeting talked about zero poverty, and I remember my own days, working with the NRLM, and when we were designing the NRLM, I think one of the secretary that time mentioned that I want, NRLM to be the last poverty alleviation program in India. I don't want, this was, NRLM was a third generation poverty alleviation program. And the whole idea was that India as a country don't need to have another livelihood or poverty alleviation program. So from that point of view, we feel that, this is the, a perfect moment to discuss about this extreme poverty and getting rid of this extreme poverty, in India. But let me start, the whole conversation. I think, I would say that we have around an hour for this conversation. We have, very intelligent audience. So I would also like to have last 10 to 15 minutes, kept for them if there are any burning questions that they would like to ask. So, they should get their say, of this 1 hour. And I'll try my best to have 2 rounds of the whole conversation. And in the first round, let's take around 5 to 6 minutes to, to give the overview of, the area on which you are working on. Let me start with Shweta. The moment it comes to the extreme poverty, the identification of these extreme poor or ultra poor, becomes super critical. And especially when it comes to, the large government program, national programs and all. And BRAC and you both, have been pioneer in this space of working with the extreme poverty, ultra poor, and extreme vulnerable households. So, what has been your experience of identifying these poor and, identifying in a way which basically also takes into consideration the local context, and all the social, psychological, multi-dimensional nature of the poverty which exists. So over to you, Shweta.
Thanks, Anjani, for that question, and thanks very much to Nudge and to Charcha for inviting BRAC here. There are sort of 2 or 3 responses to your question. And many of the audience members probably already know about this, so I won't go into too much detail. But one is to look at poverty multidimensionally. So it's not just about the $2 or $3 or $3.5 a day benchmark. I think in India now, with Niti Aayog's push, we are coming to that recognition pretty widely. The second is not to rely just on one poverty database. I think it's to pull different types of databases, poverty assessments, qualitative, quantitative, social registries in other countries. And then, of course, I think the most important part is the community-based participatory method of identification. And we are, for example, in Karnataka and in Tamil Nadu, the surveys are being done by SAG members. So we train, Pradhan trains the SAG members to actually undertake the surveys. So it's another layer of community facilitated identification, and that's how you build ownership also of the program within the different communities. So I would say there are layers of data, and then there's the community identification that then brings this process together to finally identify the ultra poor. I remember meeting a SJY participant recently in Bihar. Actually, we had gone to a VO meeting, and then I asked them, you get a loan, and the SJY beneficiaries get a grant. How do you feel about that? And the response was that we are well aware that these people, inki halat humse itni buri hai ki we don't mind that they get a grant. So that community ownership is vital in our structure, because then otherwise we risk the whole credit discipline that NRLM has created. And the targeting process, that's why it has to be community-led.
Thank you, Shweta. I think, the importance of the community ownership, is super critical when it comes to any identification process of, extremely vulnerable households and all. John, if I, now go to the another, side of the, the panelist. You have been working, again, and Nudge as organizations have been again pioneering in India. You have started your work with a pilot in Jharkhand, and now it became a national level phenomena, and you have played a very important role in terms of taking, the lessons and learning of Jharkhand, working with the Jharkhand SRLM, to the national level. So this whole scale, how do you see this program, scaling and reaching to large number of extremely vulnerable households and all, and what kind of a and especially when when you scale a program, they tend to lose the flexibility which requires to work with extremely vulnerable households and all. So one side, not losing the flexibility, but also the use of technologies becomes super critical. So how do you keep a balance between these two when you are scaling a program?
Thanks, Anjani. Great to be on this panel. This is the fourth time that we are bringing some of the best organizations here to talk about this topic. And scale is very important for us at the Nudge Institute, and we love this phrase that we often repeat, that simplicity scales, complexity lingers. We are very aware that I think the sector also is very aware that graduation approach as a design is multifaceted. There are many elements that have to work together and tied to each other. It's sequenced. We've spoken about this many times. Knowing fully well that this is a model that is multifaceted, it requires many components within, especially when done within the government. They need to work in tandem. You do tend to have points of failure. And therefore it becomes very, very important to think about simplifying the design as a means to solve for operational excellence at scale. So solving by design for operations is something that we have seen carries a lot of value. One of the things, while there are many vectors to think about, one of the things that we are very excited about is the ability of simple technology to reduce the cognitive load of the field staff, of the professionals, so that they can focus on doing what they do best, which is coaching, which is hand-holding, and create that magic on the ground. If you see the life of a change maker or a field staff on the ground, they have to take care of distribution of grants, they'll have to create bank accounts, they'll have to provide access to entitlements, do livelihood planning, coaching, so much that they have to do, and we expect all of this to be done by someone who's paid 6,000, 7,000 rupees as honorarium, or probably a little bit more in some states. So we really have to simplify their lives and let them do what they do really well. So technology plays a huge role, and the second big, and we can talk more about it later as well. Second big thing is, how do we get talent, motivated talent who are graduating out of some of India's premier institutions to take 3-4 years out of their lives and go and live in a really remote location to deliver this kind of a program. What motivates them to come to work in an organization, work with the government, and focus on impact. So cracking that is also going to be important at scale. There are, of course, questions around the second point that you raised on flexibility. That's a question that we have to keep asking ourselves. How can we contextualize this? But never lose sight of the fact that we have to simplify the program to a point where it can deliver results predictably with low variance. We will have poor results in some cases, but I think if you really have to deliver this impact at scale, simplicity of design and implementing it well on the ground is going to be super important.
Thank you, John. And I love this phrase of cognitive load. How do you reduce the cognitive load, of the frontline worker who are engaged with these programs and all. Now let's, from the practitioner, space, let's move to the, the researcher space. And so, Jaypal has been one of the, pioneer in researching this whole, initiative, what they call it, ultra poor graduation program. And already there has been several research paper, research studies, multi-country studies. So do you feel that still there is more to learn and more to research, or we have already reached kind of a evidence fatigue, and and focus on more on execution and implementation and getting that right, rather than just keep looking for a new knowledge and new research. So and if you feel that no, there is still a space for more research, what are those areas which we still need to explore and learn?
Thank you, Anjani. It's a interesting question, a broad question, so I'll try and answer in 5 minutes that you've given each of us. So, I'll take a step back to say that in the last 2 decades, Jaypal, along with IPA, our partner organization, and many researchers and many implementing partners and governments and non-profits across the world, we've evaluated the graduation approach across 5 or 6 countries. All of them have been randomized controlled trials because we want to understand what works, the most strongest causal evidence for this graduation approach. And that's how all of the evidence that we have today, the rich evidence, is essentially a testament to the collaboration and commitment of so many different actors in the last 2 decades to reach where we are today. Now, given the momentum that we have today, we can just sit back and say, this works, and it's being scaled, and hallelujah, there's a silver bullet and we are fine, right? But just the fact that we have many implementing partners on this dais, each of them doing different innovative things, there is a space to innovate. There are newer contexts that we are looking at. So we are working with refugee communities across many countries. We are looking at impacts of climate change. We're looking at migration and migration to urban areas. We are looking at, John's talked about some technology processes, and you're talking about simplifying the design, but it's a new piece that is being introduced in the entire scheme of things. We're working on green on a green program for the graduation approach. So each of these, and then we've been discussing the last couple of months, and even yesterday we were at a conclave where we were discussing who are the newer people who are being left out and who are marginally excluded. So beyond the ultra poor women who actually form the core part of this program, there's talk of the elderly, where there's talk of disabled people, transgenders. So there are newer geographies, newer contexts, social norms are changing. All of this will require continuous, evidence generation. Now, when I come to what I mean by evidence generation, so we don't necessarily need to do a randomized trial each and every time. I think we've done a lot of that. We know that the full program works. But there are, in low resource settings, in newer geographies, in newer contexts, with, tweaking the model will require us to look at what are the different components that are working well. So ultimately, we do need a comparison group. And the comparison group could well be the full model. We don't need to have a pure control, but you always will need to be able to compare to understand what are the incremental impacts, what are the additive benefits. Otherwise, we are doing a disservice to the program, disservice to the implementation, and disservice to the evidence which has been generated over the last 2 decades. So we want good evidence. Just a pre-post might not cut it. Process monitoring actually is one of the most important components of this program, and all of the partners on this table, on this dais, are doing a lot of detailed process monitoring ongoing, and that's going to give you incremental impacts. It's going to give you, what are the gaps at every stage, whether it's the asset transfer, whether it's the identification, whether it is adaptability of the technology from the frontline workers. Every stage you're going to get some information. You're going to see if some phases you might find that the incomes are reducing. There's something else that's happening. What's really going on? So you need continuous process monitoring, and beyond a pre-post, that's what it'll give you that. But I would really argue for also some amount of experimental evidence, because you can see variations. And I will caution about internal validity and external validity. A lot of what we will end up doing, I'm quite sure, is 2,000 households here, 200 households here pilots. But when you want to scale that, you need to generalize. And how do you generalize with findings which are internally valid but not externally valid? And I think that's a question that's going to start coming up. And that's why I feel that ex ante thinking about what are the methods that you're going to use, what are the instruments, are these instruments generalizable across contexts, are the questions generalizable across contexts, how are you thinking about the methods that you're using? It's going to be a mixed methods, qualitative methods. You throw in a quasi-experiment somewhere, do a staggered approach, for instance. You will get your comparison group just there. So I think we have to think about the design questions, but I do believe that we will still need the evidence across some of the new. So I've talked about newer aspects that we will look at, but newer questions will be climate change adaptation, migration. It's going to be whether government systems can really adapt and scale this without external support. Right now, we have many organizations who are supporting governments, but when we, 5 years down the line, the idea is for governments to take it up themselves. So can a government really adapt a program like this, which has many complex aspects, and can they really take that up? So we will need to continuously generate evidence.
Thank you. Thank you, Sohini, for your, your thoughts around continued investment in the research and all. But let me go back to the, John and Shweta, because I do believe that I'm a firm believer in the demand-driven research. So as a practitioner, Shweta and John, where you feel there is a knowledge deficiency when you are implementing this program, across, multiple states and all. So if you could also throw some light, that area where you feel, quite confident, an area where you still feel there is some kind of a knowledge and evidence gap. Shweta, why not you start, and then we'll go to
I think what Shobhini already mentioned about process monitoring, I think that's a demand that we see a lot from state governments. Regularized feedback that's independent, that's well crafted, that's looking at all layers of the program implementation. So not only household level, but also the district level and the state level. You know, what mechanisms are failing, what mechanisms are working. So that's something we hear. I think in terms of broader questions, the most burning one for me is, and BRAC is already sort of investing in that question a lot, is will this succeed, will this program succeed without investment in climate adaptive tools, climate adaptive technologies, climate adaptive solutions? I think that's the future for the next 2 decades or so at least. The other question that we are still exploring, and we're talking to JPAL and partnering with their researchers on, is does this program succeed when it's government-led in urban areas? When the family structure is different, the community structure is different, almost absent. How do we then do this? If we need to, and of course there's a sort of tertiary question there, which is that without family support, can women, do training for 8 hours for a skill development voucher if you don't give her childcare? So I think questions around more gender intentional, supportive solutions to participants, questions around climate, questions on urban, is something that we need to work on.
Perfect. John.
Sure. No, I +1 to Shweta on questions around climate and gender.
Is it working? No, you can take.
No, I agree with Shweta on questions around climate and gender. I think there are, I'll add to it by spotlighting 2 areas. One, there is evidence in the 10-year follow-up study about the durability of impact of the program. But we do know that the program has been tried in many contexts, with variations. Do we know that the enabling conditions that existed in that original multi-country study exist today in all the locations where graduation approach is being implemented? Therefore, will this durability be seen? What are these enabling conditions? Can we understand them deeper? If they don't exist, can we create them? We do think of our community institution infrastructure created by NRLM as a great platform for the poorest of poor households to land on. But is there more? I think that requires continuous study. But I think the second part is more everyday learning that we have to do to answer questions. Because I think there is definite benefit to doing studies over a 3-year period, synthesizing that, and like Shobhini said, being able to compare and contrast. But there is also great value in the kind of work that JPAL has been doing, process evaluation, and even other kinds of learning and generating data and learning on the go. Because this kind of program, especially in India, as we scale fast, we need to learn much faster. We should be able to iterate, tweak, let things fail, fix on the go, so that we are able to get to an answer much faster than what a 3-year or 4-year study would allow. A lot of questions can be studied on that. So it's more a learning approach than very specific questions, because each context will throw a new problem at us, and we should be prepared as a learning organization or a learning institution, especially while working with government.
Thank you, John. Now let me go to the, my global colleagues, who have traveled all the way, and I'm thankful to, for coming and participating in this, panel conversation. Let me start with Madam Lynett. Madam, you, work with the Kenyan government, and Kenya has been, one of the torch bearer when it comes to the various development initiatives and all. So, I mean, the whole panel and audience would love to hear your thoughts in terms of how the Kenyan government is looking at, this issue of extreme vulnerabilities in a Kenyan context and all. And that will be, what India can learn, what other African countries can learn from the Kenya's experience. Over to you.
Thank you, and good afternoon. I'm happy to be here and to share the Kenyan experience. Kenya has a population of about 47 million people. And out of these 47 million people, we have 38.6% who are suffering from poverty. We have about 40.1% in the rural areas and 34.1% in the urban centers. Kenya, like any other country, also suffers from multidimensional poverty. In terms of our stunting rate, we are at, for the children under 5, we are at 18%, and the underweight are at 3%. So that is just to give you the picture of the population that we are dealing with. So as a country, we've had several social protection interventions. And one of the tools that we use is that we want to use the right-based approach and the life cycle approach. So in our constitution, it says that every Kenyan has a right to social security, and therefore it is an entitlement. They also have a right to social and economic rights. So we've had several interventions that target the poor and the vulnerable, and this is anchored under our social protection policy. We aim at having a just and cohesive society that enjoy a dignified life and high quality of life. So we've come up with different interventions that are anchored on 4 pillars. And the first pillar is on income security. This is where we have the cash transfer programs. And we intend, or we have inclusive social income security programs that target the poor and the vulnerable. So we have our consolidated cash transfer that targets the orphans and vulnerable children. It targets the persons with disability. It targets the older persons, and it targets the communities that are frequently have climatic shocks. So what we do as a country is that we give them a cash transfer value, which in other programs is called as the consumption support, of about 2,000 shillings. I think when you transfer this into rupees, it is around 3,000 shillings that is given on a monthly basis. In terms of how we dispense it, we've been evolving. Initially, we used to call the people to a centralized place and give them the cash. And then we realized that this was not working, and therefore we engaged the payment service providers. And of recently, we are now using the mobile transfers. Then we also have the social health protection, whereby we are trying to ensure that the poor and the vulnerable have access to health services. So they are linked to the health insurance fund, and we've piloted the universal health coverage in some counties, and going forward we would want this to benefit all the poor and vulnerable people in Kenya. Then we have the shock responsive program that targets the ASAL areas, that is this arid areas where we have incidents of drought. So in this one, we have a program that is known as the Hunger Safety Net program, where we give them top-ups, Kenya shillings of 2,700 whenever there is that is consistent, that is given regularly, but whenever we have an emergency, then they are given a top-up. Then lastly, we have the 4th pillar, which is on complementary program, where we are saying that giving the poor and vulnerable cash is not enough. And therefore, we have cash plus programs, which we are calling complementary programs. And that is where we have programs such as the nutrition improvement, cash and health education. So we target households that have children below 3 years, and they also have lactating mothers. So these expectant and lactating mothers, so these households are those households that are benefiting from the National Safety Net program. So they are given a top-up, and then they are also given counseling and health education. We also have the complementary program that is known as the Economic Inclusion Program, and that is where BOMA comes in, where we are targeting the extreme poor and we aim at graduating them. So in terms of how do we identify the poor and the vulnerable, we've had several approaches that we use, but currently what we have is that we came up with an enhanced single registry. So in our enhanced single registry, we have different modules. We have those ones who are benefiting from the National Safety Net program, where we have a database of all those ones who are benefiting in the National Safety Net program. And then now we've come up with a module that is on social registry. So what we've done is that we have collected data using an harmonized targeting methodology. So this is a tool that is used by all the partners, including government and non-state actors. So it is a universal tool that we use to identify the poor and vulnerable. So in Kenya, we have 47 counties, and we've been able to collect this data in 34 counties. So we have a depository of the poor and vulnerable households of about 5 million people. Those are the ones that the community have identified using the universal tool that we came up with. And that tool was developed by both the state and the non-state actors. So once we have the poor and vulnerable in the social registry, it means that if you want to implement any social protection program, then you don't have to collect data. What you need to do is just to go to our social registry. So from the social registry, it is weighted and it is ranked. So we have the most poor, the poor of the poorest going upwards. So if I want to target, for example, 1,000 people, then it has ranked me with the poorest at the bottom, then moving forward. So we have, if any organization then would want to access that data, you can access it, and you can be able to utilize it to benefit your targeting. So we have approaches that are universal, and we have those ones that are specific, but it is contextualized to a specific program. So maybe when Sam will be speaking, he'll give you the specifics of what we look for under economic inclusion program. So just to give what, as a government, we have done under the economic inclusion program, which is a complementary program, is that when we want to identify the poor and vulnerable household, we will use the data from the enhanced single registry as our baseline. So we will get the number that we require from that enhanced single registry, and then we will take it back to the community. Remember, this data was collected at the community. So we'll take it back to that specific community, and we will do what we call community validation. So using the parameters that we've set, we will now ask the community whether they feel that this specific individual meets or household meets that criteria. So that step is known as community validation. If they feel that there's someone who was excluded, then we will do what we call an on-demand registration, because we want to ensure that no one is left behind. So we create awareness to the community for them to be able to understand what is the criteria of identifying the poor and vulnerable households. So, and to minimize complaints and grievances, this is done in an open forum where all the stakeholders are involved. both government, the community, the opinion leaders, the church leaders are all invited in a public baraza where they are able to validate. Then after that, we again move to the specific households just to try and verify that data. So as a government, there is in Kenya, we've done so much in terms of social protection programming, and the government has put in money. Like, for example, under the cash transfer, we have about 1.7 million beneficiaries, and this is fully sponsored by the government. Thank you.
Thank you so much. I think it was worth listening, the whole community validation that you do of the social registry, because in many countries, the social registries are prepared at the high level, at the, national and the state level, and community do not have any much say on that. So it was great to hear, the process that you followed. Now let me, go to Sam. Sam, your organization is almost, working and touching 1 million lives through these ultra poor graduation approach and all, and and you all have been, by the way, had an early advantage of starting these programs and all. So if you could share, what has been your experiences of working on the ground with all these under this program, and also one area which I liked about the work which Shweta also touched upon is integrating the climate change aspect of in this ultra poor graduation approach. So if you could share your thoughts on that.
Yeah, thank you very much, Anjani, and thank you, the audience, for coming to join us in this conversation. I looked at the theme of our session, and sunsetting extreme vulnerability is clearly an urgent agenda, and it is a global agenda, because poverty in India is poverty in Kenya, and poverty in Kenya is poverty to the world. So the opportunity that we've been given by the NAJ is a great one, because sharing experiences, global South-to-South dialogues is very, very key, because through that, then we harness ideas, skills, knowledge, and experiences that can help us accelerate the transformation that we want to see to exit and lift people out of extreme poverty. And I think, like for BOMA, and I want to appreciate Madam Lynett for providing the context and the systemic level interventions in Kenya that have already undertaken, showing the progression that we have towards eradicating extreme poverty, which is something which I believe is achievable within our generation, and I believe all of us in this room attest to that fact. When I sit here as BOMA, one of the things that delights me is that we are a clear demonstration of the power of collaboration. So even as we come towards the India's largest collaborative convening, BOMA is a clear testament of what you can achieve through collaborative practice. Because when I look at the panelists, BOMA is actually an offshoot, quote unquote, of BRAC, because we basically picked the BRAC model and then tailored and contextualized it for the drylands of Africa, building up the solution, the graduation approach that would address the context, the communities, and the needs for the communities that live in the drylands of Africa, starting off with Kenya. And then when I look at JPAL and their sister Innovation for Poverty Action, I've actually been our research partner and currently working with us to experiment on how we can combine graduation approach and environmental conservation to achieve holistic outcomes on economic prosperity and environmental well-being. And then when I look on my right and see the government, who has been our key partner in scaling the graduation approach in Kenya, and what Madam Lynett has highlighted was a story that could not be told 5 years ago. And so it delights me that today government of Kenya can actually share the growth and progressive activities and experience in moving towards a stronger social protection system that embeds economic inclusion and particularly graduation approach in supporting the extreme poor, households and individuals. And of course, the nudge has been our learning partner, a lot of collaboration on how we can strengthen our government level engagement to take these solutions to scale. So back to your question, Anjani, of course, not forgetting they're called donor community, but I call them mission partners. Because, donor-donee is a power kind of relationship, but a mission partnership is actually anchored on an agenda. And I can tell you for a fact that from my own view, eradicating extreme poverty is not a project. It is not a transactional exercise. It is actually a journey. It is a mission. And we can only achieve it through mission partnership with the philanthropy community, with the research community, with the technical expertise, and of course led by government. And that is really how I look at it holistically. So we have about 400 million, people living in extreme poverty in the sub-Saharan Africa. And the poverty rates have been declining, at least over the last 20, 30 years. But we've seen a reduction or a slower rate in reduction in the extreme poverty in the last about 10 years, perpetuated basically by issues of shocks such as the COVID-19 that pushed 80 million people into extreme poverty. We've seen rising food and energy prices, particularly in the sub-Saharan Africa, and climate and conflict shocks that happen in those contexts. And the challenge is that those poverty drivers are multifaceted, as has been said by my colleagues, so they bear very different faces. And obviously, climate vulnerability is one of them. And in the sub-Saharan African context, 84% of those living in extreme poverty are in the rural areas. When I was listening to the panel in the morning, they also said that the rural areas is where there's the wealth endowment. So we can actually achieve economic prosperity if we focus our energies in transforming the rural areas to be generative enough to support the rest of the context. So when we look at it, we are looking at using the qualified, effective models such as the graduation approach that has been proven to sustainably lift people out of extreme poverty to change the story, and building it through a women-centric design that is also climate screened. Because we believe that you cannot no longer address economic poverty in isolation from climate vulnerability. So that blended approach is helping us to achieve holistic outcomes in terms of ensuring asset building for the households that are in extreme poverty, building income security, accumulating savings to help them address shocks and stresses, and also strengthening their human capital to ensure that we break the intergenerational cycle of poverty. And we can achieve that at individual, at household, at community, and also at system level, particularly focusing on the system level changes that Madam Lynett highlighted, and of course believe that together, if we harness all these ideas and engagements, we can multiply this not by an incremental or anecdotal perspective, but by a factor of 10, 20, 30, in order to completely eradicate this challenge that is affecting the global community. Thank you.
Thank you, Sam. I don't know, organizers, do we have this time for the question and answers, or we have, like few more questions that we can, ask? Okay.
I have one point I wanted to actually.
Sure, please go ahead.
So there's one point, I'm just listening to the panel here. One of the things that we've also evaluated, GPAL and IPA researchers together with different partners is, and including I think with with BRAC as well, is unbundling the interventions. So you can't always have a full, we've evaluated the full model, we know the full model works. We've been discussing different variations in terms of the context differing, so whether you're looking at a different population or you're looking at different components. But we've done some work around unbundling because we are getting a lot of questions, and we get it in India as well. We've got questions from different governments to say, okay, now you've done this in Bihar over the last 10 years, but Bihar can pay so much. And Bihar the government has put in over $120 million into this program. So not every state government can do that. So I think one thing that struck me when I was listening to everyone is that it is a complex program, but and thankfully, I think in the last decade, we've done some work to unbundle different aspects, to make it more cost-effective and cheaper, or leaner models. While the leaner models, so in Niger, for instance, we removed the asset. So we had the full program, we compared it with removing the asset, and the government was already giving a cash transfer program, so what they added was, the researchers added a skill building, skills training on top of that, and psychological support, skills training and psychological support. So while it had an impact, it was a reduced impact. So I think the way to look at it is that you will get an impact, but it's a reduced impact from the full model, and there are different variations. In Uganda, again, they've looked at removing one or two components. They've done it, they've looked at group enterprises vis-a-vis individual enterprises. They've looked at changing the model of how, household visits, group visits, group coaching rather than individual coaching. I know there's a half program in Egypt, half model program in Egypt that they're working on, where again, this is the Egypt Impact Labs with JPAL partners, the government there, is again, you take the entire program and you reduce the cost by half. So the cost of the asset is halved, the cost of the mentorship and everything is halved. So those, I think what we are seeing in preliminary results is that there are impacts, but they're reduced impacts. I think so it's very important to be able to understand and benchmark in terms of what impacts are you looking at and how are you, and these are all experiments, and the way we can look at the differential impact is actually because you have a comparison group, and the comparison group has been the full graduation approach. So as we're thinking about some of these near geographies, we might want to tweak even the model. Even more important, I think, to plug I would make for rigorous evidence generation there, Anjani.
True. I mean, when you are doing it with few thousand households to a million households and all, I mean, tweaking of the models is a consistent process that one has to do and all. I think if you have one question that I would like to, or this is the last 7 minutes that we have, or after that we'll get 10 more minutes for the question and answers. Okay. So is that we are opening up to the audience? Okay, go ahead.
Just wanted to check one quick question. That in all your experiments, both in Africa and India, is there a distinction between people who have been forced into circumstances, or is there an agency of the people involved as well? Meaning, why are
you can use the mic.
Yeah, excellent. So wonderful panel, thank you. So just wanted to check, based on your experiences so far in India and Africa as well. So is there a agency of the particular household or the household major involved, or it's just all circumstantial that people fall into this in the first place? So what I'm trying to figure out is, how do we prevent this altogether? How do we prevent these vulnerabilities, people getting into vulnerability? Or is it a genuine issue of just circumstances, or is it an individual contributory factor?
When we look at vulnerabilities, particularly if you're looking at vulnerability to climate change, they are very context specific because it looks at the social space, it looks at the economic opportunities, it looks at the services that are provided for by government. So while I may not be very conversant with India context, in Africa and particularly sub-Saharan Africa, there are those socio-cultural exposures that increases the vulnerability, particularly of women and children, of youth and refugees. And these are as basic as things like access to resources such as land for production, access to education because of cultural barriers, and many others. So that then gives you the parameters to use to target. And we factor those ones when we are designing our targeting methodology to ensure that the targeting methodology is context responsive in order to get the right persons. And one of the key success factors of a graduation approach is to get the right person into the program. If you get the wrong profile, you might not really get the outcomes that you deserve. And for our case, it is very clear that we have to prioritize women, and that is why I specifically called out women-centric designs in our graduation approaches for the sub-Saharan Africa. And otherwise, if we don't do that, the trends are showing very clearly 9 out of 10 people living in extreme poverty by 2030 will be coming from sub-Saharan Africa.
Oh, thanks, Sam. I think I've got a list of the questions from the audience. Thank you, audience. And I'm very tempted to ask to the panel members. So, there is a question for you, Shweta. How does the BRAC ensure reduced migration for work? What is the key indicators for exit strategy and how local NGOs are involved from the beginning? I know in your partnership there are a large number of NGOs are already involved,
Yeah.
but if you can throw some light on that.
I mean, I'm not
And
sure.
you can be brief, sorry,
I'll be very brief, and I'll briefly say that I don't think BRAC can claim that it has reduced migration, because migration is in fact increasing and will continue to increase, especially in Bangladesh, because of high salinity and other climate factors. But I think what we're working on is to make sure that the migration is as less distressed as possible. So how can we have planned migration, and how can we have support for migrants once they migrate into cities?
Perfect. John, the next question for you. How the nudge approach of ultra poor is different from BRAC?
Well,
that's why I thought audience questions are always more intriguing than what I would ask.
To be honest, I don't even know, because the program is contextualized. Our own programs in Karnataka is so different from the program in Jharkhand, and the program is so different from each state to state. So, but that's a good thing that it's getting contextualized, without which the design might not survive in a new context. So, I do want to say that of all graduation cash plus designs in India have a significant advantage in that they can ride on the strength of the community institution platform in social infrastructure that NRLM has created. So that's probably something that's very unique to India and Indian models. How these models evolve in the future is something that, and it should, how it evolves will entirely depend on the context.
No, thank you. I mean, some of these are a continuous evolution which has continue. Shweta, there is a question for you. And even again, whoever has asked, thank you. I mean, these are all great questions. When we are scaling up, what could go possibly wrong? Scaling up. If you have any thoughts around that, I think that will be great to share.
Absolutely. So one of this is a slightly taking a step back, and I might not talk about graduation, or I could, but when we think about scaling up, firstly, I mentioned this before, we need external validity in all of the programs that we're evaluating. You want the results to be generalizable only then. So we get a lot of criticisms actually saying that, oh, you evaluated this program in Haryana, how can you scale up in Orissa? And we're actually scaling up a gender attitudes norms project for adults and boys and girls in government schools, tested in Haryana. And yes, you can say it's scaled in Punjab because the contexts are similar, but we're scaling it up with the government schools in Orissa. So, but when we are scaling, I think one of the fundamental things that we have to understand is, are the underlying conditions similar in that new context? We've done this with education, we've done it in environment, we've done this now scaling graduation approach here. The underlying conditions have to be conducive to that, to the problem at hand, has to be conducive to the solution. And that's the basis of anything when we scale. The second we look at is the capacity of the institutions in that geography. So if you're working with governments, what is the capacity of governments? So if you need to bring in technical support from other organizations and non-profit organizations, are the non-profit organizations who are there to be able to give that kind of technical support for scaling? So these are very important elements. And then, of course, you need to have champions within the system, because if you don't have champions, things are going to fall on the wayside. So I've obliquely, I hope, answered this question, but we've seen that it's not a linear process. It's really playing the long game. It takes 8 years, 10 years. We need patient capital. We need patient support from governments, civil society organizations, and even from the participants in the program.
Thank you. The next question, which is again a bit tricky. Madam Lynett talked about life-based approach and right-based approach. And when we work on the ultra-poor graduation, where do you see the scope of the right-based approach? Do you see the possibility of any integration of the right-based approach with ultra-poor graduation approach? And anyone can take up, that question.
I think the first step in the graduation cycle, if you will, at least in India, is access to entitlements. So the coach or the MRP goes to the household, make sure whatever entitlements they are, entitled to, that they actually have. A lot of ultra-poor people don't have basic entitlements like right to food or, other right to. Exactly, all security schemes. So I think that's very well integrated, and luckily for us, it's not an either-or question. I think it's, we're not having a debate here about social protection versus livelihoods, at least in our context, and that's a good thing.
Yeah. And I think it is just that we are coining it now to be a right-based approach, but I think a dignified livelihood is every individual's right. And we should aim at this as providing dignity to those that deserve it most as part of their right. Nobody chooses to be born in a poor household, but everybody has the opportunity to change their story. And that is really why we exist and work with governments to make this a priority.
Sorry. When you look at our development agenda, we have in Kenya our Vision 2030. And in that pillar, we are saying that we want to have a just and cohesive society. And therefore, even when we were drafting our constitution, it is in our constitutional Article 43 of our constitution says that every Kenyan has a right to social security. So we, in terms of our agenda, is that we want to ensure that everybody has a high quality of life and a dignified one. So, and our guiding principles is that we will ensure there is equity, we will ensure there is inclusion, we will ensure that there is no discrimination whatsoever based on gender, based on race, based on your health status, based on your economic status. So that is embedded in our constitution. And in our constitution, we say that it is a government for the people, by the people. So that makes it an inclusive environment.
I agree with the understanding of graduation approach in that it is flexible. You can have access to entitlements as an integral component of the program, and that's the beauty of the design itself. I do want to caution that it's very easy to box certain designs, not just graduation. Graduation approach is one of the designs. Box certain designs into a formulaic approach that doesn't change over time. Like Shobhini said, it's important to understand the underlying principles, underlying conditions that made those principles work. So if we keep thinking first principles, we might learn that in certain geographies, a rights-based approach might be the better choice, or might be over-indexed on a rights-based approach, and in some cases the mix of the design might be different. So as long as we stay focused on the first principles and sort of not get caught up in this categorization of programs or very tight descriptions of programs, I think we are good.
Thank you. Thank you, everyone. I think there are some additional questions, but in the interest of the time, I would like to wind it up here. We had a fantastic conversations, starting from identification of the poor to how to scale the programs, and we are at the cusp of a history where we do see the light at the end of the tunnel, where we can see that we have dealt with the extreme poverty and all. So thank you so much, all the panelists. Thank you so much for the audience for patient listening, and thank you so much for to all the organizers, to organizers who who put everyone brought everyone together in this room. Over to you.
Thank you very much. I think the quality of questions was a testament to the depth that the panel brought to this discussion. Very grateful. Thank you, Anjani. I also apologize for the issue with the timer and the Q&A. But thank you all very much. Thank you to our panel. We will see you on the other side of lunch for the closing plenary, which is set to begin at 15 minutes past 3. Thank you.